Well, hello everyone. My name is Lindsay McCoy. I am the creator and co-founder of the Body Ready Method. I am an exercise physiologist and a birth doula of 15 years, and I have trained, now 2,000 professionals in the Body Ready Method, and tens of thousands of families through our work virtually, and then of course in person. I am the daughter of a labor and delivery nurse, the granddaughter of an OBGYN, and funny enough, my husband's father was an OBGYN. So I was like, no, thank you. Like dinner talk was episiotomies and hemorrhages, and I was going into exercise science, thank you very much. And then going through college, I got really interested in special populations, thought about doing cardiac rehab, worked in that for a while. Then when I was starting to think about having my own babies, got really into the research and what was going on with prenatal exercise, realized there wasn't a lot of great, like the law of specificity. I'm training my marathoners for a marathon differently than my swimmers, differently than my gymnasts. And then when you get pregnant, people just say, just listen to your body or just do yoga or do what you've already been doing. And we haven't ever been taught to listen to our bodies. And so it's really not the best approach. And then I was also starting, when my first birth in 2007 was not the way Ina May Gaskin's Guide to Childbirth told me it could be, right? I needed to know why. I'm a science nerd, I'm a researcher. And so my second birth in 2009 was like the portal to who I am. I mean, they were all the portal to who I am now, but it was like, I remember I had him at 1:54 a.m. and I was like, people need to know. I couldn't fall asleep. I was like on this high. My husband just wanted to sleep. And, within months, I was attending births as a doula. The first birth I ever attended was 40 hours long, ended surgically. And again, like I was starting to see this disconnect from what I knew biomechanically and physiologically and what I was seeing supported in practice, even just like the positions people were put in. And so I just became obsessed. And that's kind of what I do today is I teach doctors, midwives, nurses, doulas, chiros, pretty much anyone in the perinatal space. And then, I've spoke at ACOG and ACNM. And then I also teach families how to support their own bodies.
Let's start off by having you tell us what it is that you found out about your first birth. What did
Yeah,
you dig into and what did you find? Just
what
tell us
did
a little
I
bit about
find?
tell us how it went and then tell us what you
Yeah,
found.
I would love to. So my first birth, I was 21. I was 21. And I was I guess a people pleaser. Like you think, I was like, oh, I hired a midwife. So I got midwife, so I'm good, right? So whatever they say is probably right. And so, I kind of just went into that birth. I also thought, oh, 40 weeks. Like I'm gonna have my baby at 40 weeks, right? Or actually as a first time mom, I assumed I'd have my baby at 38 weeks, of course, because I was so done being pregnant. And then when my baby wasn't born at 40 weeks and I felt some contractions, essentially I put myself in the hospital too soon. And they said, oh, we'll just give you a shot of something. They didn't even tell me what it was. You'll wake up in labor. It'll all be good. Well, it was morphine. I woke up, my baby's heart rate didn't look great. So then they induced me. And yeah, I didn't have a cesarean, but I'm surprised based on kind of the way things went, that I didn't. And it just, I was stuck in a bed with a cord coming out of me and I felt like I was just there with cords, just passively listening to what people told me to do. And it just it wasn't bad, but it just wasn't what I thought it could be. So then my second birth in 2009, despite, I actually covered this all on my podcast that's no longer happening, but despite my family being very against it, I had a home birth, hired a midwife. It was just a beautiful experience that I kind of had to hide from my allopathic medicine family, who they now get it, but that was 2009. There wasn't freestanding birth centers yet where I lived, and so I was kind of bucking up against a lot of preconceived notions about what that was. So I really shifted and I saw what it could be versus what it was. And then their journey just continued from there because then after that second birth, I had diastasis recti and pelvic floor, issues. And then I was like, wait, this is also something that's really not addressed. And even the research back then was saying, well, if you have twins or a history, there wasn't really a lot of specific understanding of things like pressure management and ways we could actually support the pregnant body to not, it's like people are telling, like, oh, that's just part of being a mom. And you're like, well, Not necessarily.
Maybe it doesn't have to be, right? We just
Yeah,
accept
yeah,
it, but there are things that can
exactly.
be done. So talk to us about what can be done. What do mothers
Yeah.
need to know?
Yeah, there's a lot that can be done. So I think the way that I like to approach is it, I like to approach it from a individualized approach. So that means if I was an alpine ski racer, so I use and I have an injury from that, and we have sudden stops in gravity, we have car accidents, someone's a volleyball spiker, we all use our bodies in different ways throughout our lives. And so as a result, we all have different patterns in our bodies, and those patterns impact our body's experience through our lives. And so for me, I had this kind of shifted pelvis that creates tension on one side of my pelvic floor more than the other. And so, that created SI joint pain on one side, which a lot of people with that, then they say, well, that's just because you're pregnant. Well, yes, pregnancy is a big load and it's adding to this already inherently a little bit imbalanced structure, and then it's showing up as a symptom. And so rather than focus on the symptom, I want to go back to the root, right? And I want to say, like, what is that communicating with me? And how might that also impact the birth experience? So if one side of the pelvic floor is tighter than the other, baby's just accommodating the space they're given. Maybe they tip their head to the side, go asynclitic to get through. Maybe they turn to the other side. There's a lot of different things that could occur. So for that, it's like addressing that. And the same thing with diastasis recti, the pelvic floor. Like if we can get that system working well, it's not just about spot treating, let's say, the pelvic floor, right? If the pelvic floor is the symptom, that doesn't mean that's the root of the symptom. It might be your diaphragm, right, is too tight and is pushing too much pressure downward. It might be that your body is too shifted forward and you can't access your glutes, right? So there's a lot of the cool thing about it is the same stuff that makes your core and your pelvic floor more functional for life and for, through this process is the same stuff that can optimize your body for birth. And so it's not like, here's your pelvic floor stuff, here's your core stuff, here's your birth prep. Like it's all the same stuff. Um,
You know what that reminds me of?
yeah.
We interviewed Gail Tully. I don't know
Mm.
if this is right. I think it might have been episode 54. It was way back in like October of 2020. And I remember how surprised I was to learn she was talking, I think, about her niece, who was a softball player and had that repeated motion of using the
Mm-hmm.
bat to hit the ball over and over and over. I guess being a righty, she was always swinging left. And after enough hundreds or thousands of times of doing that, they actually found that her cervix itself, what the uterus was twisted and torqued, and the
Yes.
cervix had
Yep.
moved off to the side. So theoretically, if
Yeah.
if one were to reach inside and look for the cervix, it would not have been there. It was twisted to the side. And when you just said we can feel a symptom, like that woman's walking around unaware that that's happened inside her body, but she may get a symptom of one hip being tight or something.
Right.
You're saying, well, let's look at what's causing that because that very thing can be impacting the birth. So unwind whatever it
Exactly.
is. That's really
Yeah,
interesting.
and I will say a lot of people, then the solution often is, and I love the solution, things like the forward leaning inversion will acutely release that, right? So we can acutely bring that uterus into balance, but that's temporary. That's about like 2-ish hours. And then what are you going to do? You're going to go back to moving through life the way you've been moving through life, right? And so we need those reactive responses is what I call them. Like we love techniques like the forward leaning inversion and things like that. And also, if we can teach, let's say, the glutes to support themselves in a more balanced way, if we can teach her to shift her pelvis, she's probably shifted one way. Let's learn how to shift the other way. Let's teach those tissues to be strong in a more lengthened position, right? And so there's kind of two pieces. There's proactive preparation, and then there's reactive response. And so birth professionals need to understand how to respond like at a birth. Let's say a softball player or volleyball spiker, they get really tight sacrotuberous ligaments, right? If I'm at the birth, I should know how to release the sacrotuberous ligament for that individual. But if I'm meeting them at 3 months pregnant, let's give them stuff so that I don't need to release their sacrotuberous ligament at birth, right? Because I want the birth, like we want it to be boring, right? I say like the boring birth is the goal. I don't want to have to use all my fancy tools and techniques, and I will if I have to. But like my goal is just to be like, you're amazing. Here's a sip of water. And then in pregnancy or even sooner, let's give them some support so that they can like proactively find more balance in their body.
how many midwives or OBs in your experience are asking mothers in their initial prenatal visit if they were an athlete, if they were a skier, if they were a soccer
Right.
player, if they were a
Yeah.
ballerina? I mean,
Well,
who's
I
doing
think
this?
more and more, hopefully. I just spoke at ACOG, Minnesota ACOG, and they were really interested and fascinated. So I'm really thinking like I want to believe that the things are shifting. But yeah, I mean, even do you sit at a desk all day, right? Do you cross your legs always to the left? And it's not in a shame way, because I think people can take what I'm saying to the extreme. And then I see posts on Instagram that are like, never lean back, never tuck like my pelvis is tucked right now and it's okay. Like, right? Like people take it to the extreme and expect people to like lean. I had a VBAC. VBAC moms get really, I get it, right? You can be really anxious about baby's position, especially with all the stuff about like scary stuff about baby's position. And I had a client once who was literally watching TV, like leaning forward, and she was so terrified of even like leaning back. And it just made me feel sad for her that I don't want this to be taken in a way that I'm saying like, okay, only be aligned and never move out of that, right? That's not the goal. The goal is to allow your body to get access to all of its ranges of motion, right? And like have more variety, release some restrictions, not to hyper focus on like how you're sitting all the
Yeah,
time.
I'd love to comment on that because that's
Yeah.
exactly what can happen. When I
Yeah.
start working with my clients on day one, in hour one, I have them question whether they are perfectionists because it sounds like
Yeah.
one of those like humble brag qualities, the old interview, like, oh, I'm a perfectionist. And it's actually a really destructive quality. I identify with it. I think many, if not the majority of us do. And what perfectionism really means is you exhaust your resources going toward one particular goal, like strive for excellence, not perfection. But it's really counterproductive in the example that you're giving, because if you tell a woman forward leaning is optimal, which it is, that's
Yeah.
in part because we spend so much of our lives reclining. And when we're telling women to forward lean, we're really just saying like, sit well, have a natural forward leaning tilt. But if they say, okay, like if that's good, I'm going to do it 10 hours a day. Now that's unnatural. Like our ancestors did not do that. They didn't sit in a forward lean. They walked more, they moved more. And
Right.
that's what we want. We
Exactly.
want movement in the pelvis and movement in the knees.
Exactly.
So yeah, we have to be so careful of how women hear the advice given, because the perfectionist is going to go running with it. And not only is she going to do that, she's going to have anxiety around it because she's going to keep thinking she isn't doing enough of
Exactly.
it.
Yeah. I always say with great knowledge comes great responsibility. Like when I teach my professionals to like assess a body, things from things like their rib cage angle, their infrasternal angle will tell us so much about what's going on in their pelvis. There's a lot of things that we can assess, but we're not going to say, even if we're thinking, okay, they're oriented to their inlet, so they're narrow in their outlet. And so I want to help them create more availability in their outlet or vice versa. I'm not going to tell that client, oh, your pushing's going to be long, right? Like that's not helpful. And we don't know that. There's so many different things. It's just one data point. But as a professional in the back of my brain, I'm going to say, okay, they spiked a lot of volleyballs and they're clenching their glutes. And I'm going to just keep that in my brain. I'm going to give them tools for pregnancy. And then I'm just going to be like, hey, I might want to do this at their birth. Maybe not, right?
And when you say
We just
that, you
gotta,
mean a particular exercise might be required. Is that what you're
exactly.
saying?
Yeah.
Mhm.
Yeah. But who knows, right? And so it's just about, it's about, I think a lot of times as birth professionals, we have this metaphorical bag of tricks and we kind of like, it's like a double hip squeeze, forward leaning inversion. We kind of just pull them out at random. And I'm trying to get people more to the point where they can really be what I call a birth detective and really hone in on that body, mind, spirit. It starts with the nervous system. When I was teaching ACOG, it's kind of funny. They hired me to teach with the biomechanics, right? Like the very clinical, how does the pelvis open with these different movements of the leg and spine and arms. And I was like, I can't even tell you guys, like, we can't even talk about that until we talk about the nervous system. My whole approach is, I say F the BS. I don't know if you swear on the show, but it's F. That's how you remember F the BS. First is flow, then balance, then space. So we have to address the nervous system. If someone is scared and they're running from an imaginary tiger, what's opening their pelvis more going to do, right? And so we have to address it kind of in that order. First, we help them with the flow and the safety and that ability to go into what I call the labor flow state. Then we can help support balance if needed, right? With different techniques and tools. From there, then we get to the biomechanics of like, are the knees, where are the arms to help create space. But ideally, we teach people to be intuitive. If you gain access to these movements in pregnancy, and you're in your flow state, you will intuitively find the movements and the positions that create space where the baby is. So my job is not to like be the physiological manager, right? That's what the allopathic people do, right? Is they just like manage the birth. We're not managing the physiology. We only jump in with that if it's needed. Otherwise, I trust that intuition.
That's a way better assessment anyway.
Exactly.
That's a real skill and the best
Exactly.
skill.
Yeah.
So let's get into the nitty gritty. Let's talk about
Sure.
let's start with the woman who was not a professional athlete,
Mhm.
doesn't really have a lot of aches and pains, has no idea if she's
Mhm.
tight on her right side or left side or back side or front side. She's
Mhm.
just going through pregnancy, ready to have her baby, and she's having a long, well, let's, even before we get into labor, let's talk
Sure.
about what she should do in pregnancy to help have her smoothest, fastest, best labor. And then maybe you can get into like the first things that a woman should do if her labor seems to be taking too long or, going
Sure.
slow or stalling, even starting with the flow and then getting into the balance and how to make space.
Sure. So in pregnancy, body ready method, we have 5 pillars: pelvic floor, pelvis, movement patterns, core, and upper body. So those are like our 5 pillars, and addressing all of them will help create like a readiness in the body. Of course, we also need to talk about readiness in the nervous system and the mind. So that's a whole thing. I love the power of the mind and that stuff. And a lot of people do a lot of great work with that. So you definitely have to prepare your mind. You have to get a good team, right? It's like mind, body, team, right? If you want sushi, don't go to the Italian restaurant, right? So get a good team, prepare your mind, nervous system. And then the third piece that I really kind of try to focus on is helping to prepare the body. And so some really key things, one of the ones that the more I work with the body, the more I become obsessed with mobility of the rib cage and the breath and using breath to create space. So if you have compression in your rib cage, and I don't think you won't be able to see me, but like if your rib cage is compressed.
Yeah, people are going to see you. It's on YouTube. So show us, give us all the details. Cynthia and I are both, right when you said that, we are both sitting up a little bit,
Oh,
taking a deeper breath, stretching our ribs.
I
So
love it.
show
I love
us.
it. So if you think about it, we wear a lot of tight bras, right? We don't breathe into our ribs. We thrust our rib cage, so now the back of my rib cage is compressed. And so when we have tension here, it pushes down into the pelvis, right? And so the more we can create space in the rib cage, the more we have space in the pelvic floor. They literally mirror each other. So I will assess people's breath a lot and say, okay, they're maybe breathing side to side, but they're not breathing front to back, or they're not breathing. And so it corresponds with a space that's not moving in the pelvic floor, because it's literally the two sides of kind of a system. And so that's one of the biggest things I say, is to learn how to breathe into your rib cage 3-dimensionally, get out of the tight bras. It's not always about movements. It's also about things like how tight's your bra. And that's a simple one, is we can get, the rib cage is going to expand anyway. And so we need to allow for that space. So upper body mobility, on my Instagram, I have a lot of different movement tips and things. So there's a lot of upper body stuff there. With the pelvis, it's about helping that pelvis find a state of neutral. So a lot of people are either in a state where they're in what's called a posterior pelvic tilt with a lot of tension in their glutes and their hamstrings, or they're in a more anterior pelvic tilt where there's a lot of tension in kind of the front side, their psoas. And so we can teach people how to assess their own pelvis, and how to do movements to help with that. You can also hire a body ready method professional. We have over 2,000 all over the world, and many do virtual. But really, it's about learning how to work with your body. And the cool thing about this work is that the same stuff that makes birth tends to help with the efficiency of the birth. Like I said, it helps your core and pelvic floor, but it also helps, when people have these injuries at birth, a lot of times it perpetuates through their life. I want to be jumping on the trampoline with my grandkids, right? I want to go use my body to hike that mountain. I want people to not be limited based on their experience through their childbearing years. And so I really do think it's helpful to be proactive. And I know, someone who hasn't given birth yet and they don't know what to expect, doesn't always have the same buy-in as someone who's had a previously difficult experience. But there are simple things you can do, like learning to breathe, learning how to hinge at your hips, right? And things like that. So it's a long story, but being proactive in pregnancy is absolutely the way to go with that. And then I think your second question was what to do like early labor, right? So early labor, when baby's trying to get into the pelvis, we want to do things that are creating space there. First, of course, we want to not freak out, right? Like stay calm. And even that positive, like, ooh, this is it. I'm going to get up. I'm going to move. Well, is it the middle of the night? Let's just sleep, right? Like, let's conserve our energy. The goal isn't to be in like the most inlet open position forever. The goal is to move and to breathe and to sleep and to nourish yourself. But if I'm meeting someone in early labor or I'm meeting someone who's about to be induced for whatever reason, there are some simple movements and tools that I'm going to do with almost all of them to just kind of optimize that process. I mean, it could be as simple as heat on the lower back, right? If somebody's QL muscle, which is the muscle connecting the back of the pelvis to the back of the ribs, if that's very tight, which is tight when we have what's called an anterior pelvic tilt, it can create it can make it more difficult for the back of the pelvis, the sacrum, to do what's called counternutation. And so if we can release those tissues, we could do what I call the glute scoot, we could do heat on the low back, we could get in a tub. When we release those tissues, you could have your partner massage your lower back. That allows those tissues to release, and now that sacrum can counternutate, and now baby can get into the pelvis. So it can sometimes just be a few little things that are needed. I'll sometimes, if I have a client in prodromal labor, I will often go to their house, kind of assess what's going on. One client I remember is where I created the glute scoot at her birth because she was in an anterior pelvic tilt and then she had a lateral shift. So one hip was higher, they were both more forward. So baby's not getting into that pelvis as easily, right, as a pelvis that is able to counternutate and kind of balance out. So baby's waiting for a more balanced space. And so we were able to release that grippy one-sided QL. We were able to get her lower back to release. And then, I went down the street to work at a coffee shop and she called me within 2 hours. She was in labor. She had a baby that evening. So yeah, simple things can really help when there's just a little extra need.
What about the woman who doesn't have a body ready method person helping them through their birth? Maybe has watched your Instagram a little bit, but obviously, as you said, we don't want women getting too much in their head about this. We could definitely see mothers starting to feel like, am I doing the pelvic tilt right? What the heck is the glute scoot? When do I need to do the glute scoot? Like there could be potentially a lot of overthinking.
Yeah.
So what about just the idea of a mother and baby sort of having that intuitive flow communication, and mother moving her hips naturally in the way that her baby and body need? How much of that is happening in your experience? And then are there a few little things that you can just nudge women in the right direction, like a few little things that they don't have to overthink that can help them in this process?
Absolutely. I mean, the things like the glute scoot and the reactive response, you don't need to know, and you don't even necessarily need to do. That's for the professionals. I believe, when I don't know if you have more professionals or lay people that listen to this podcast, but how I speak to professionals is a little different than how I speak to families. Because families, your job is to really hone into your intuition, hone into, peace and flow and breath, and to not overthink it. You're not going into labor. Okay, that's okay. Let's keep nourishing our body. Let's keep that calm spirit about us versus what is wrong? Something must be wrong. Sometimes early labor can just take a little bit of time as baby is journeying through, and your job is not to overthink it. I always joke there's only room for one head in your pelvis, so get yours out of there, right? As a pro, I'll be all up in there with my head, but your job is to not overthink it. And most of the time it works. Birth works. And your job is to not overthink it and to just go into that flow, especially if in pregnancy you've practiced the different movements of birth. you can just show up and just flow and just believe. And that's why I see people who have never given birth just intuitively move into the positions that their baby needs. I remember one client jumped up on the bed and did this crazy movement, and I was just like trying to spot her so she didn't fall off the bed. And after the birth, she goes, "Why did you pull me up into that position?" And I was like, "I didn't do anything. I was just making sure you didn't fall off the bed." And so that's all just to say that your body knows what to do, and your job is to just go there. And we're in an altered state of perception in birth, right? We go from our prefrontal cortex, which is that thinking, judging, planning brain that we don't want to be in birth. We want to go into this like deeper, more limbic place. And so that's why when I see someone, overthinking and, they're fully clothed and they're like, "What should I do now?" And then they go in the bathroom and they come up completely naked and there's like, I'm like, yes, they're in the flow. This is what we want. And then you just see it work.
You mentioned that you mentioned that there were some specific birth movements that people could practice prenatally, so that they intuitively come during the birth. Can you talk about those?
Sure. So learning how to tuck and untuck your pelvis, not in a cat-cow type way, but truly like nutating, being able to nutate and counter nutate is one movement. Having access to both internal and external rotation of the femur. So a lot of people at rest are either in a position where they're more internally rotated or they're more externally rotated. So you'll see like the duck feet or the people who kind of walk in the outside edges of their feet. And then you also see the people who are more pronated or more internally rotated. And so just learning kind of where you are limited and finding access to both of those movements. I like to say the first time you ride a bike, you shouldn't be in a bike race, right? So the first time you're moving your pelvis in all these ways, you ideally aren't in birth. And so internal, external, tucking and untucking, flexion and extension. So a lot of people are very good at hip flexion, because that's what we're all doing right now. We're sitting, right? So we're all in some degree of hip flexion. And a lot of people lose access to hip extension. And actually hip extension widens the anterior, posterior, front to back diameter in the pelvic inlet, right? That's why flying cowgirl, if anyone knows that position, that's why that works. And I've seen that one taught wrong because people say, "Oh, you need a big curve in the lower back." You don't want a big curve in the lower back. That's back extension. And so learning, a lot of this is like a game of telephone sometimes with birth pros. And I've noticed when we bring it back to the biomechanics and say, okay, let's invite that person to tuck their pelvis under, find true hip extension. Now we're actually widening the inlet. But if somebody hasn't practiced hip extension and they don't really have a lot of it, which is very common in our society, it can be tricky to just kind of force it at birth. And so finding access to hip extension is also going to help you strengthen your glutes, which is going to help them stop gripping and tensing the back of the pelvic floor, which is going to allow that pelvis, again, that ability to move, nutate, counter nutate. So yeah, those are the big ones: internal, external, flexion, extension. And even, another one that I like to add in is when we reach the arms up, you see people a lot of times as they're pushing, they'll reach their arms up or they'll like pull them in. Well, why are they doing that? Well, the latissimus dorsi inserts from the arm to the sacrum via what's called the thoracolumbar fascia. And if we have a lot of tension there, right, if we're like in this more extended position, it can be difficult for that, pelvis to create space. And so opening up the lats with some upper body mobility movements can be really powerful as well.
Are you saying when women have that inclination to reach up and pull, they're relieving the tension and they don't realize they're doing it, or they're adding to the problem?
When they reach up, they are encouraging nutation of the sacrum, which is an outlet opener. So isn't that super cool? So
Yes,
I actually started thinking about that because I love looking at old depictions of birth. And we have one of Cleopatra, and there's one of a pioneer birth that I found in like medical research. And the Cleopatra birth, her attendants are reaching her arms up as the baby is being born. And in that pioneer birth, they're pulling the arms forward and pushing the knees back. And they might not have realized, like the word that we have today would be like the thoracolumbar fascia is nutating the sacrum, blah, 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 right? They just knew we do this and the bottom opens. And now we have like the scientific stuff to back that up. And that's why I'm like, ACOG, ACNM, look at this.
And they're going to
And
say, that's so cool. Tell us more. And then it's going to take them 20 years to get around to making any changes. 'Cause that
Right, I
happens.
know, I know.
Yeah.
I've seen it done in the hospital with sheets hung from the
Yeah,
ceiling. And in both of my water births, I hung a Maya wrap
I
from the
love it.
ceiling specifically for pushing because when I got that urge to bear down, all I could
Just
think about was lifting my
reach.
hands up. Like it just had to be done.
That's
And then
amazing.
to have something to pull out tension on, and then on the knees in the tub, the
So
length. I had
good.
no idea why I
Yeah,
was
and you
doing
don't need
it.
to know why, right? The
Just
birther doesn't need to
absolutely,
know.
yeah, it just
So
was like that's what my body needed to do. And yes, in all birth rooms, there should be something hanging from the ceiling that women can grip onto because
Yes.
it helps so much with the pushing.
what would you
Yeah.
say to a woman like me who strongly preferred birthing on hands and knees? And I didn't have that inclination to pull. Does that mean that that
Good
worked
question.
against me because I didn't pull, or does it mean maybe I'm not naturally tight in that area? Like, why
Yeah.
did I not have that inclination?
I think everyone needs a little bit different things, right? We don't know. We don't have the information that baby has and we don't know what's going on inside. And so I really trust the birthers. One of the things that I have seen, the whole internal hip rotation, people call it now knees in, ankles out, but actually knees together is not internal hip rotation. That is adduction and that will narrow the space. And so when you see people say like knees together, I'm like, no, keep the knees under the hips and ankles wide. But does everybody need internal hip rotation for their babies to be born? No, if that was the case, then we'd have a lot less babies being born because a lot of people aren't just finding internal hip rotation to push. And it's the same with the reach up. Like your body might not have needed more space. It might, I didn't push in knees in, ankles out. I was on my knees. I didn't reach up. But if let's say I was pushing and pushing and pushing and the baby's not coming and I'm, on my hands and knees, maybe my doula or my midwife or someone could say, hey, you want to try holding and reaching and pulling this thing? Maybe we need it. We can sometimes support adding more space or, hey, let's see if what happens if we widen these ankles a little bit or we do this or that. And so sometimes if the intuition isn't there or something's in a delay, we as professionals should understand how to create more space or how to create more balance for those people. But most of the time, you're going to find if you feel safe and you're in your flow, you're going to find the positions that work best for you. And sometimes, you see some people rounding around their babies and some people actually intuitively more arch. So we don't all have the same bodies, the same patterns. So we don't always need the exact same things to help our baby journey through the pelvis.
This is why it's so important that birthing rooms are set up in a way that allow women to move around. Obviously, they should be out of the bed. In the home, it's happening intuitively, but very few women are giving birth at home. But
Yeah.
hospital rooms need bars. They need things hanging
Yes.
from the ceiling. They need squat stools. They need the bed to be in the background, not the foreground, because then mothers don't have to think about all this stuff. They can just see something that their body and their mind is called to, and then they can go and use it. And they don't have to necessarily be put into the flying cowgirl unless unless there's a
Yeah,
prolonged period of time
exactly.
where a woman really feels stuck. By the way, that position looks extremely uncomfortable for a woman. Do people
Right?
actually like that?
I mean, I don't use it all the time, very often because because my clients get a lot of prenatal prep and they don't need to like be in this extreme hip extension. I mean, same with Walters. You guys know the Walters position, right? Where you're like, that's the same thing. If you take flying cowgirl and you flip it into a different plane, it's the same thing. All of those are just hip extension
Why
from a
don't you
different
describe flying
position.
cowgirl for the listeners? Because we have so many women who are going to be wondering what you're talking about. Just do your
Flying
best to
cowgirl.
describe. Yeah.
Do you want me to like show it up, right? Since
Show
I'm
it so
actually
that the
on
YouTube
video.
viewers can see it
So
and talk it through. Yeah.
it's like you're in an extended position. You're tucking your pelvis under, your knees, your legs are behind you, and then you put a peanut ball between the legs. So it's basically hip extension. And if you think Walters, we put someone on their back and we extend their legs down. I'm not showing it very good because I wasn't prepared to be on video with it, but yeah,
Good,
it's just an
good.
extreme hip extension movement, which is going to, I can show it on a pelvis, but it's going to take those sits bones and pull them so that we are widening the inlet. So I really like Walters, I say is my big guns, and I have done it at maybe 5 births, honestly, Walters. I say if you're doing Walters at every birth, you're doing something wrong because that's extreme. It's not fun. And the times I've done it are the times where it's like, okay, are we going to do a cesarean or should we try this first, right? Like if you're trying to get everyone's baby to engage by putting everyone in Walters, like you're missing something. There's more stuff you could do.
So is that for the babies who haven't dropped? Like what's your indication for doing that?
So for Walters or for the hip extension, there's a few different options. If you're trying to get a baby into the inlet, again, that's going to widen the AP or the front to back diameter in the inlet. If though, I've also used it, and I've taught this to a lot of labor and delivery nurses specifically, if the baby's hasn't yet being born and they're just like pushing really, really hard and there's just like there's no progress. Sometimes it's actually the shoulder, it's not just the head, right? We have a whole baby. So sometimes the shoulder can be held up at the inlet. And so sometimes putting someone, like taking a break, the time I'm thinking about, the first time I tried this, my client had an epidural. She was pushing I think she was on hour 4. And the midwives were really great. And I said, hey, can we try something? We put her in Walters for 3 contractions. She didn't really push. She had an epidural. And then we flipped her back onto hands and knees and her baby was born 2 contractions later. So it was like that shoulder just needed to slip under the pubic bone. So there's a couple different reasons. And again, this is not something that I think families need to know, right? That's not your job to know these what if situations. Your job is to flow with what is and be intuitive. And then the birth professionals do need to, in my opinion, understand all of this stuff. Especially doctors, they're only taught how to add force. I often show this with a toilet paper tube and I say, okay, squish it, less space. And now the baby's not coming. So what does the medical model do? Okay, let's add force. But if we create space and balance first, oftentimes we eliminate the need for any extra force.
Yeah, Pitocin is often not the solution, but it is always the solution.
Right.
Right. It's
Or
always
forceps and episiotomies and everything else.
Or even nipple stimulation, right? I mean, it has a time and a place, but it's trying to add power behind the contractions, which is sometimes needed, but very often we need to address flow, balance, and space first.
Just out of curiosity, how often are you finding yourself having to use these more complex, more detailed types of positions or protocols in physiologic versus non-physiologic birth?
Yeah, so I mean, if somebody is in a more physiological birth supported environment, right, like a home birth, they tend to be able to be a lot more intuitive with their movement, right? And they tend to feel safer to flow through their process. But still, sometimes definitely I've had to do various different techniques at home births, because there's all kinds of things that can show up. If somebody has a really, really tight pelvic floor, you can't just like flow and relax enough to release that tension, right? Like a pelvic floor that is really, really tight is still a pelvic floor that's really, really tight during birth. So definitely home birth, there still is sometimes a need for some of this extra support, but it's definitely less common in home birth than when somebody is really fearful and out of their flow and constantly interrupted and has a team that's not as patient or willing, right? And so sometimes I will say as a doula, I'm not making the medical decisions, right? Of course, I'm just supporting my client for, variety of situations. They may be choosing to be induced at 39 weeks, right? Or they might be choosing whatever they're choosing. And so my job is to kind of support through that. So sometimes I will need to do more of my kind of reactive tools. I mean, it can be as simple as, where do you squeeze the hips? Like when I'm doing a comfort measure, a lot of people like press really directly in at the sacrum, which I'm like, that can relieve back pain, but it's not addressing why we're having back labor. So why not, if someone's already having back labor and they're already hired me to support their comfort, why not address why they're having back labor or create some balance, release some tension, rather than just pressing in that actually might be preventing the birth from happening as efficiently.
So, Lindsay, just for any woman listening right now who's pregnant, what are just the first basic things she could immediately start doing right off the bat? Without knowing her body specifically or her
Yeah.
history, what are some like no-brainer, definitely, if nothing else, be sure you're doing this?
Yeah, so my very favorite thing to suggest people to do is to walk. Our ancestors walked, we need to walk. We sit a lot, right? We sit in chairs, we work at the computer, we round forward, we wear tight bras. And so walking is, allows the psoas to free swing. It allows a lot of suppleness in the tissues. And so going for daily walks is also so good for our mental health. And so just getting, and running is not a replacement, right? So it's like get walking, get moving, is the first one. Get out of the tight bra and start breathing into your rib cage is the second one. Super simple, right? You don't need anything to do that. Learn how to hinge at your hips, right? When you're leaning forward to spit out your toothpaste, do you round your spine or can you hinge at your hips, right? It's very simple. And I would say then the last one would just be to start learning how to manage your stress, regulate your nervous system. This is great preparation to being a parent, which is very stressful, right? And so if you're really stressed now and everything is chaos now, like we're also developing that baby's nervous system. And so just allowing yourself to, after you've heard all of these things and you're like, oh, that's a lot. Okay, but that's not for you, right? Your job is to just breathe and eat good foods and go for walks and dance with your partner and laugh with your friends and just enjoy this journey. And I would say it's about like flowing with what is, right? And that's the whole journey of life, is just flowing. I just got back from some travel and the travel home was really chaotic. And I was like, okay, this is just the rapids part of the flow, right? And so my job, I can't stress about what I can't control. I couldn't control delays and storms and really not great airlines. I can choose to not go with them again, but like your job is not to control this whole process. Your job is to take control of the controllables of this experience and let go of the rest. And I think that is honestly the journey of life.